welcome to my pharmacology poster board presentation. My name is Jean-Marc, and I'll be talking to you about the drug cephalexin. Cephalexin is a broad-spectrum antibiotic that belongs to the first-generation cephalosporin class. It is a beta-lactam antibiotic characterized with a beta-lactam ring. It is also bactericidal. This means it essentially kills bacteria and stops bacterial growth. Cephalexin is the generic name for the drug, but it also goes by the name Keflex as the brand name. Now to offer an explanation for cephalexin's physiological effect on the body and how cephalexin actually causes bacterial cell death. Essentially, cephalexin's beta-lactam ring binds to penicillin binding proteins. This stops the transpeptidation reaction, which is the last step in peptidoglycan synthesis. Now, because peptidoglycan is a major component in the bacterial cell wall, without it, cells cannot survive. That's what gives cephalexin its bactericidal effect and ultimately leads to bacterial cell autolysis, which is also known as cell death. Now, as far as contraindications go for cephalexin, cephalexin is contraindicated in patients with a hypersensitivity to cephalosporins. Patients with this hypersensitivity, if they're administered cephalexin, it can result in really bad drug rash. That means like hives on the patients. It's also contraindicated in patients with penicillin allergies because they're at a much higher risk for that allergy to cephalosporins. Cephalexin can also cause some drug interactions with metformin and probenecid. Now, moving on to some side effects. Cephalexin can cause side effects like abdominal pain, gastritis, diarrhea, and colitis. Now, going along with this, it is rare, but cephalexin and many other antibiotics have been known to be the cause of C. diff infections. This is very serious and can be fatal. It can also cause dyspepsia, nausea, vomiting, candidiasis, thrombocytopenia, and neutropenia. In terms of indications for use for cephalexin, it's an antibiotic, so it's used to treat bacterial infections. Most commonly, it's used to treat gram-positive bacteria, but it also can treat, it's very effective with gram-negative bacteria. Indications for cephalexin include staphylococcal and streptococcal skin and tissue infections, respiratory infections caused by streptococcal pneumonia and staphylococcus pyogenes. It's used for surgical site infections, staph, bone infections, but most commonly, cephalexin is actually used to treat urinary tract infections caused by E. coli. Now, in terms of pharmacokinetics, cephalexin is administered orally and quickly absorbed into the body. It's absorbed in the upper gastrointestinal tract, and it takes just about 1 hour for it to reach its highest plasma concentration. As you can see on this visual, you see the cephalexin concentration compared to time, and that'll give you an idea for how quickly this drug is absorbed and reaches its plasma concentration. It's distributed in the body through various different bodily fluids, blood being one of them. 10 to 15% of the drug binds to plasma proteins in the body. Cephalexin is not metabolized in the body, and the body actually excretes cephalexin through urine. In fact, more than 90% of the drug is excreted through the urine and is unchanged. That's what gives it a really interesting effect, and it's used a lot to treat urinary tract infections because the cephalexin is unchanged in the urine. Cephalexin is administered most commonly through oral medication. It's administered in tablets and capsules in doses of 250 or 500 milligrams, usually taken 1 to 4 times a day. Sometimes the dose can be as high as 4,000 milligrams a day. Sometimes it can be about 1,000 milligrams a day. Cephalexin is also usually administered for a period of 7 days. Here's just a quick visual of what cephalexin capsules, 500 milligram cephalexin capsules, would look like. I found this really interesting visual here. It's just the medication box that cephalexin might come in. It comes labeled with the generic name, cephalexin. It shows the dosage. It shows instructions for adult dosage. It shows how much is in each capsule. directions for storage, and just some interesting text here on what might come on the package of a cephalexin prescription. I also did want to include some interesting background about cephalexin. It was first developed in 1967 and approved for use by the FDA, the Food and Drug Administration, in 1970. So it's been around for a while now. Another really interesting fun fact about cephalexin is that it was, in 2020, the 101st most commonly prescribed drug in the United States. All right, just to review everything we've talked about today, cephalexin, or Keflex, known as its brand name, is a broad-spectrum antibiotic that's used to treat a number of gram-positive, gram-negative bacterial infections. It's very commonly prescribed. It's contraindicated with mostly allergies. That's really what you wanna know, because people who have those allergies to cephalosporins, you really have to be aware of that when treating patients. Yeah, this is it for my poster board presentation. Here are my resources. I used 2 websites and our pharmacology textbook. Thank you all for listening. Thank you for taking your time. And if you have any questions, please leave them in the comments of the discussion, and I'll be happy to look over it. Thank you for your time.